We're going to begin with urgent warnings from America's top medical experts that the U.S. could hit 100,000 daily cases of the coronavirus without action. Nearly 45,000 cases were reported just yesterday. That's according to Johns Hopkins. And that is the second highest total since the pandemic started. About 45% of those cases came from just 3 states. They are Florida, Texas, and right here in California. Each reported more than 6,000 cases yesterday.
Top health officials told lawmakers yesterday they're very concerned the U.S. is heading the wrong way.
We are now having 40,000+ new cases a day. I would not be surprised if we go up to 100,000 a day if this does not turn around.
It is critical that we all take the personal responsibility to slow the transmission of COVID-19 and embrace the universal use of face coverings.
Also on Capitol Hill, the Senate passed an extension of the Paycheck protection program hours before it was set to expire. If the House approves, small businesses will have until August 8th to apply for federal help.
Dr. Ashish Jha is the director of the Harvard Global Health Institute, and he testified before the Senate on the pandemic response just yesterday. Joins us now. Dr. Jha, good morning. Dr. Fauci, we heard say we could have 100,000 new cases per day in the not-too-distant future. How do we avoid that? And perhaps the better question is, how do we get people to actually follow the guidelines that we know can work?
Yes, so good morning, and thank you for having me on. We can avoid it. We don't want 100,000 cases a day, and we can avoid it. We know what works. We got to get everybody to wear masks. We've got to really think about indoor gatherings and whether we can afford them. I think largely we can't. No bars, no nightclubs, no gyms. And then we've got to keep going on testing and tracing. If we can do those things, we can get there. But to your question of how do we get people to comply, that's leadership. That's leaders coming out with a consistent message every day about the importance of exactly those things.
Well, you mentioned yesterday in your testimony on Capitol Hill that you'd like to see a stronger federal response. Short of that, is there a way that state by state there can be enough of a response to actually slow this thing?
Yeah, so, we have not had much in the way of a coordinated federal response, and so we have seen sort of 50 responses to the pandemic, and some of them have been very strong. I think some governors have done a fabulous job, and I'd like to see more governors take this on. But at the end of the day, it's going to be hard to fight the biggest pandemic in a century if the federal government is absent. So I do think states can do a lot, but a lot would be really helpful if the federal government helped.
Yeah, the trajectory here seems pretty clear. There are certain segments of the population that no matter how many times someone like yourself says wear a mask, wash your hands, stay distant, it's not going to sink in. So can we at least say that the hospitals and that the medical community is more prepared now than perhaps they were in April or May?
Yeah, I do think we're more prepared. We've gotten better at taking care of this disease. We have more protective equipment, but by no means is it sort of foolproof. And I'm worried that hospitals are starting to run out of beds. We are starting to run out of protective equipment. So I still think there's some serious challenges ahead.
We heard the director of the CDC mention that he'd like to see universal face coverings, but face coverings are not all created equal. And I want to show people some quick video here. The first image that they're going to see is just a cough, no face covering at all. You can see the germs spreading out almost 12 feet. Next up is a bandana face covering. You can see what comes out of your mouth contained a little bit more. Third is a surgical covering, surgical grade face mask. And then finally, after we see that one, you can see better containment there. And in pole position, very interestingly, a stitched covering, which seemed to be working best of all. That is just something you would be made on a sewing machine at home. When you see those differences there in terms of how germs are contained, what does that tell you about what we should be wearing? Clearly, they're not all created equal.
Yeah, so they're not all created equal. And obviously, first of all, I think all of the evidence, not just this study but others, suggests that something is better than nothing. So any face covering is better than doing nothing at all. But yeah, absolutely, those surgical masks are better. The stitched cloth masks are better. If people can do those, and those are largely accessible now, so people can do those, that would certainly be a big improvement over bandanas. And all of it is better than nothing at all.
Yeah, you mentioned we are 50 states, and we've had 50 different responses. Europe is also a collection of countries. They've had different responses, but when you look at the continent, they've been able to bend the curve in ways we haven't. What lessons can we learn from Europe?
Yeah, so there's one lesson, I think, and one lesson only in some ways at the end of the day, which is that we got to take this virus seriously. You know, Germany took a different approach than Italy, which took a different approach than Denmark. So countries can take different approaches and get there, but all of them took it seriously. All of them did social distancing and really aggressive testing. And that, to me, are key features that all of us have to do in the United States.
Yeah, last question here. I think a lot of people are waiting on the vaccine that might return us to normalcy. How hopeful are you the end of the year is still a good timetable?
I think end of the year is going to be extremely difficult. Look, we may have a vaccine that we've identified by the end of the year, but we don't just need to have a vaccine. We need to feel comfortable that it's safe, that it's effective. Even if we have it identified, producing hundreds of millions of doses, which I know we're getting going on now, but having it ready for people, I think it'll be more like spring of next year if everything goes well.
All right, Dr. Ashish Jha, thank you very much.